for the cryosurgery, I was awake. And then the anesthesiologist told me, I'm going to put something in you so you will sleep. Yeah. That was the end that I knew in the operating room. Well, after 2-3 hours, they brought me to the ICU. And my brother was there. He was in the gown. I said, why are you here?
Do you feel pain when you received the cryosurgery?
No. It's amazing. There was no cut. There's no injection. I think they went through the natural channel to reach out the tumor in the prostate. Very powerful technology. No cut. No pin.
No open surgery.
It's really amazing. Then I feel good. Then I had 5 days on the catheter. Oh, my urine was great, clean, regular. And before I came here, sometimes I go to the bathroom, maybe 8 to 10 times a day, during the day, night and day. So that was my biggest worry, even when I came here. How can I go 10 times in the bathroom in the airplane? But then, when I came here, I noticed that my urine was normal. I probably go to the bathroom 3-4 times. It was totally good. It's normal. I felt it was normal. The flow is good, and there's no more retention. That was my biggest problem in the U.S. You pee, and then there's some more. Every day, every hour, sometimes I will go to the bathroom. That was gone when I came here. With the cryosurgery, after they took out the catheter, I was looking at, what's the improvement with me here. Well, last night I went to the bathroom 3 times. Usually I go 8 to 10 times. So it was normal.
Yes.
No pain.
With your experience, what do you want to tell to the other patients?
Well, I think what I like to tell the patient is have hope, have the desire to live. Trust the doctors who are here to help you. You need those. You have to believe in them. But of course, more importantly, believe God. That He's there, yeah, and He's all planning this for all of us to be able to get the right cure. I totally believe God directed me into this area. Although it took 8 months, I believe that my 8 months of making the decision, the 3 months of pain that I went through, that I will be very effective to people who have not been here, to people that would think about this but never were like me that didn't want to go. Because I have been here. I've experienced the procedure, I experienced the treatment, everything I thought that was good, and I can share that. So, going back to your question, what kind of treatment, I got the cryosurgery and the combined immunotherapy. Those are the things that I'm doing right now, and so far they're doing good. Of course, yesterday they gave me 3 injections. It was painful.
Do you have any difficulty in communication in Sudan?
No, I was amazed that we understand each other with the nurses. In spite of their communication, we still can communicate. And I felt that there's something in there. Why, in spite of the language difference, we are able to communicate with the nurses. Yeah. And one thing I like about where I am is when I press the button, within a minute, there's a nurse that will come. Well, in the U.S., you're lucky if you get one hour to see you.
So sorry.
Yeah, no, you're already in pain, you're already dying, there the nurse comes, right? Let me tell you another comparison, because I've been trying to compare what we have in the U.S. over here. See, in the U.S., I had been 3 times surgery, 4 times surgery. So just like you, before the surgery, you do a catheter for the pee, right? Well, over here I noticed 2 times a day, they clean the catheter. And then 2 times a day, they flush the catheter. So there is no chance for your blood to coagulate, to clot. That's why the water that's coming in is always clean, always clean. Well, my experience in the U.S. is that the first time I had the surgery, and even the following surgery, they put a catheter with you, right? They never clean the catheter until you leave the hospital, even after you leave the hospital. They don't flush it every day, so you're in pain. You still see a lot of blood every day, blood. And then it has to come back natural that it will be clean. And then they will say, take it out, go home and take it out yourself. But I did not do that because I was afraid to take out my catheter. So anyway, I went to the hospital and they took out the catheter. And then you sit down for a few minutes and then pee. If the pee is clean, you can go home. So I did that. So I pee about 1200 cc, 200 cc, and say, you're fine, go. But after 2 weeks, blood coming out, I cannot pee again. So I went to an emergency in the hospital, and because I cannot pee, it's so difficult, right? Emergency and an ambulance. Once you get to the hospital, they still don't attend to you. You have to wait. You're dying, not being able to pee, yet there are no people to come to you and consider this is an emergency, this guy needs help, they don't do it. So I'm very happy with your service. I'm glad that God helped me come here, and you, I think, being able to take care of your patients.
Thank you.
Yeah.
Okay, thank you.
Thank you.
Thank you very much.
Give me your card. From Mendoza.
Mendoza, yes.
Yes.
My friend.
Yeah, because Domingo and Dr. Mendoza went to Cebu. He said, I want to talk to him. So he called me in the U.S. Nestor, he said, you have to look at this. You must have it. There's nothing that you will look at life. That's the end of it.
If you know Mendoza's condition.
Thank you. Thank you
I
very much.
hope you will be lucky.
I'm good. Yeah,
Yeah.
I am. Right now, I feel very lucky.
Thank you. Okay.
What's that?
Thank you. Thank you.
Thank you.
Also done.